All right, thank you for being there. So we still have Dr. Ndubisi here with us talking about digital eye strain in the country. But before we come to guests, let's take some few tweets to see what social media uncles and aunties are saying. Okay, so our first tweet here is from I Dr. Jane. Okay, and she said, how many hours do you spend on your phone daily? That was the same question I asked at the beginning of this discussion. Now ask yourself, do you give your eyes any break? Blurry vision, burning sensation, heavy eyes, headache, that's digital eye strain. Try this today, 2020 rule, your eyes will thank you. Okay, that's what we've been saying. And then our next tweet is from Helios, and he says, if you have chronic dry eyes, digital eye strain when working on a laptop, an underrated factor is sitting next to an open window. If there is a constant breeze, that will dry your eyes out even more and makes it worse. Just sitting in a different angle can help quite a bit, okay? And then if you can also remove the blue light, that will help even more. I'm just trying to understand what you mean by if you can remove
blue light.
The shield,
blue light.
like to shield it, like a computer shield.
Okay, to take it off.
No, there's a shield that limits, like it's another screen in front of the screen.
Okay,
yes.
Okay, to take it off. Okay, so that's it for our tweets. Now, there's something this person mentioned that just brought up a question in my mind.
Windows issue.
Yeah, exactly.
Yes.
What's your take on that?
Yes, no, she's very correct.
Okay.
The point she's bringing is that when you're supposed to wind, just like drying clothes outside, the eye handles tendency for dryness.
Okay.
And when it dries, digital eye strain worsens. The symptoms of dry eye and digital eye strain, they're the same. So when the eye is dry, digital eye strain is worse. So it means that if you are in a room, apart from closing the window or backing the window, you should not face the fan. When the fan is facing you, it dries the eye more. Digital eye strain worsens. The same thing, possibly the AC should not face you. Sit adjacent or back the AC. And some people have also advocated that an AC should be combined with a humidifier so that the room doesn't get so dry and makes the eyes worse.
That makes sense. Sometimes when you're working in an AC room, a cold room, you tend to have this dryness in the eye. Okay.
Yes. Oh. When you are driving and the nozzles to the AC are facing your eye, after a while it seems to be tearing. Because that's one of the features of dry eye.
All right, so I have this question here from someone. He said, why is buying eye drop from chemists without a prescription risky? What should people look for instead?
I want to thank the person that asked this question because my experience is that we've lost so much eye from drug abuse than from the pathology itself. So eye is such a delicate organ. If I came here, one of the things I was dealing with is someone that used the wrong drug. And I was telling the doctors I'm working with that it's a very bad case. If we don't do something urgent, this eye is gone. So you come to see that there are some, across the counter drugs, steroids. They can alleviate pain. But you don't use steroid in an eye that has a little wound. It will widen the wound and eventually melts the eye. So when people are I will just tell people, anyone that deals with drugs, the best you can do for somebody, if somebody comes for you to buy drugs across the counter, advise the person to see an eye care practitioner, so that the person will come with a prescription, so you are safe with what we are doing. I've seen people who went in and got drugs that alleviated pain but melted the eye. So I won't stay on air to say don't use this drug for that. That means like promoting self-medication. So what I would say is that anyone that comes by your stand, kindly ask the person to see an eye care practitioner and come back with a prescription. It will save many. Because somebody will tell you, I actually bought it from somewhere. But for the fact you bought from somewhere does not mean it's like red eye. Red eye can be caused by 30 things, 30 different things, but the eye just appears red. What you use to treat red eye from A is different for you to use red eye from B. So this 30 people might come with red eyes, and the treatment for these 30 red eyes are different. But for the fact you used one thing, it's worked for you, should not mean you go and send to your auntie in the village. When it happened to me, I used this one, it worked. So it melts it. And the worst case scenario is not even buying the eye drops. But the question is very, very important, because people think that once I have bought this from a shop, that it will cure. No. Please see an eye care practitioner and get a prescription. But another practice I'm seeing, where I'm concerned, that I've even seen the literates getting involved in this, is that people have a problem in the eye and they use urine. They say the best thing you can do, use your urine. You know, I've treated like 2 or 3 undergraduates. That's why I got concerned now, that who use urine. What happens if that urine by chance is infected? The tendency of melting the eye. Some years ago, a family brought their breadwinner. He used urine. By the time he came, the eyes, unfortunately, he used in both eyes. Both eyes had melted, and the contents of the eye were pouring out. So, and there was nothing we could do at that time. So these are practices that should be discouraged. Use of urine in the eye is lethal to the eye. Use of breast milk solution is lethal. Salt water solution. The worst of all, pluck a leaf and squeeze the liquid in the eye. Most of this liquid, they have acidic contents, and once it touches the eye, it begins to melt the eye immediately. So by the time the person is now presenting to you something that would have been taken care of within 3-4 days, you are managing it for 1, 2, 3 months, and at the end, you still don't get a good result because someone had listened to a non-professional in managing his eye.
So doctor, you just raised a very serious concern. Thank God you brought that up, and you've actually said it's a no-no. But you see, sometimes some people get this, like you've said, recommendations from a fellow person,
especially grandmas in the village.
For. So how do we now, you know, like I can tell Nancy, I have a headache, I pour the urine on my head and it works. And she will go try. So how do we now advocate and try to, you know, tell people to desist from, you know, doing what others do when it has to come with medication?
Yes, that's why this forum is good, you know, and for you guys in the media have to help us a lot in this. I can say categorically, since I came to Akwa Ibom, I've seen people lose their vision from harmful traditional medication than any other thing. The cataracts, the surgery is done, person sees. Even the glaucoma, they says that is irreversible. If you manage, the person can see for life. But this issue of self-medication, using harmful traditional medication, is so rampant that we need to, you know, lend voice to what we're saying here. You know, so no matter what somebody used, and it's worked, it is still not evidence-based medicine. That it worked does not mean it's evidence-based. Yes, because it didn't go through the procedure of a prescription from a medical practitioner. So what I will still tell everybody, you know, most times we are afraid that if we go to hospital, we'll spend money.
Exactly.
But when it gets complicated, we will still spend that money. You will spend more and still not get the expected results. So what I will encourage everybody, in University of Uyo Teaching Hospital, there are consultant ophthalmologists there. In some of the general hospitals in this Akwa Ibom state, they have consultant ophthalmologists there. And we have optometrists, quite a good number of them here. So I would advise you, quietly go to teaching hospital or any of the hospitals that has an ophthalmologist, and then ask the person, are you an eye professional? It's the right to know. If a person is ophthalmologist or optometrist, they can offer some help. If he's beyond the optometrist, he can refer to ophthalmologist. Then just go somewhere and someone just offers you anything for something as delicate as your eye. You need to see people that have lost their eye from carelessness when they cry. They cry and beg you. A man had once told me, name your price. I say, sir, it's late. You know, if you lose your hand, you can manage the other one. When somebody loses his sight, it becomes dependent. A man told me he rather dies than go blind, because even those that respect him will insult him. So this precious sight that God has given you, take the extra mile and see a professional. We have quite a number in Akwa Ibom, not much, at least we have up to 7 ophthalmologists in Akwa Ibom State. At least I can tell you where to see them. Teaching hospital, they are there. Some of the general hospitals, they are there. We have the optometrist, quite a number here. So you know who is taking care of you, and the person will advise you better. Anything you pay, you will have value for this, the service you paid for, than just going to take things from by the side way. The person will regret eventually.
You know, once upon a time when I just was thinking about going to see an eye doctor, you know, and then I went through, that's why sometimes I begin to wonder if there's this witchcraft inside our phones, you know. Within that period, just that day I was thinking about going to, I started seeing different adverts on what to do to take care of your eyes. It's as if the person read my mind and was giving me different herbal drugs, you know. And then I saw quite a number of them, lots of them, herbal drugs, herbal teas that could take care of your eye. So I begin to wonder, all these teas, because some of them sound quite genuine. So is there any link between what you take and it taking care of your eye, like the herbal tea I saw on the internet? Is there by chance those things can work to rectify the sight?
I'm happy you brought this issue now, because it's been an experience. Most parents will come and carry cups and say, this one, my son in Canada brought this. My daughter in US brought this and that, and that. They'll say that this is from here. I won't call the companies, you know, but we've been trained to know what to look out for in any product.
Okay.
So what I do before I recommend, I say bring the products. I will look at the contents and see what it contains. There are some things that any supplement should have for the eye, and it baffles me that at times some of those things are written in Chinese. I'm not able to read them. I don't know what it contains, and I can't recommend them. So what I would say to an average Nigerian is this: there's what they call ARED study, age-related eye disease study. And it says that most supplements should have some basic things like some minerals, some vitamins, some lutein, zeaxanthin, and antioxidants. But a careful study showed that all these things are extracts from our fruits. You realize that someone who feeds more on mangoes, his pawpaw, his cucumber, his carrots will eventually get these things. What I tell people, if you don't like the fiber, you blend them. So these are part of the lifestyle education she asked. You know, you stay more on natural food. These eye supplements are highly advocated, but make sure that what you are taking is what is recommended for the eye. So before you start gulping them, meet your eye care practitioner. Let him study the contents and be able to offer a professional advice.
Okay.
Yes.
All right. All right, now let's talk about oil. Do you want some? I wanted us to talk about some of the misconceptions we have, you know, when we talk about sight. Some persons will say, well, if you begin to have eye issues at the old age, it is nothing medical, it's just old age taking its toll on you. I don't know if you have others you would like to debunk today.
Yes, let me start from the one you said, you know, that's old age here. Most of the problems we have in eye has age as a risk factor. In fact, the commonest cause for acquired cataract is age. I had a session with a woman today before I came in here. She kept pressing me, I want these cataracts to dissolve and go. And I told her, can you dissolve your gray hair? She said no. I said the only way to remove gray hair is to pick it out. So cataracts is a physiological aging process. So when someone is telling you that I can't see far, you know, everything is appear like Hamatan and Okladi, just take the person to a healthcare practitioner, eye care practitioner, you will take care of it. That's cataracts. Another thing I want to debunk is children wearing glasses. Some parents think it stigmatizes a child to wear glasses. There's something we call amblyopia. Amblyopia means this child has an eye problem without any noticeable disease entity in the eye, but the child cannot see. You've looked at the child, everything is fine, but the child cannot see. So that amblyopia, what causes it most times is that this child had refractive error. Refractive means that he needed glasses, but the parents didn't give this glass on time, until he got to an age where the brain has accepted that this is the limits of what the child can see. So if you now start giving glasses beyond that age, you might not have any improvements. So I want to speak to parents on air. If you notice that your child is bringing his homework close to his face, he is going to the television, very close to the television, don't assume. Don't say these children are wahala. Take that child to hospital. You must solve a lifetime problem, because that plastic period of eye development is like the limits of 8-9 years. Beyond that period, if you're not trying to, if the child had not worn glasses before, and you're trying to force glass on that child, you don't make much progress. So that amblyopia is why what parents don't give glasses, it's just stigmatization, that they will say my child has a disability. It's not a disability. If that child gets corrected, he will do well in school, he will strain less, and he will have less problem in future. I've seen many people that have this amblyopia, now they're like in their 20s and 30s. No matter the correction you are giving them, you don't bring them to optimal vision because correction was not given on time.
And do they really reverse with the glasses?
Well, it depends on the type of error the person has. For instance, a child that is long-sighted may correct with growth, because long-sightedness is common with small eyes. So that child is small, its eye is small. As it's growing, the eye is also growing. So with growth, long-sightedness can be corrected. So it's not all refractive errors that correct with age, but some do.
Oh, okay.
Yes.
Have you ever heard or seen where people say they see the environment suddenly turned green? Like seeing total greenness everywhere.
Well,
is that
there are some conditions the eye. It may not be specific to green color. The person may see. In fact, there are many things people see. In some group of people, they will see. They are seeing dark spots. Others will say they are seeing cobwebs. So this seeing dark spots, cobwebs, is still an aging. One of the things that happens is the aging processes. They call it floaters. So floaters can be caused by aging process. In those days, they say from 60, but recent studies say that from 45, people can start seeing things like cobwebs. They are seeing cobwebs, but it's not real. So it's a degenerative change happening inside the eye. And that's what can cause floaters is, assault. Someone that has a hit in the eye can bleed in the eye and start seeing floaters. Also, diabetics have a high tendency of seeing floaters. Then the issue, some people can just have sudden blackouts and also see again. When someone has that, don't assume. The person has to be properly assessed. The vessels in the eye has to be checked to be sure there's nothing blocking the flow of blood. And if you trace that, the person should also be referred to another doctor to check the blood flow in the heart. Because from this eye alone, you can see something that has to do with the eye. If the eye is the only organ in the body, you look inside the eye and look at the way the blood is flowing. You can tell who is hypertensive from the eye. You can tell who has HIV from the eye. You can tell who is diabetic from the eye. So there are people that are trained to look at somebody's eye and tell you this thing your daughter is complaining is beyond the eye. See a heart doctor. So that's why I'm saying that when it has to do, don't just say eye is not just eyeglass. There are many things that can be diagnosed just having a thorough eye check. So it's important.
I'm glad you said this, because sometimes when I look at the eyes, we don't see anything. So you have to be trained.
All you see, when you look at it, all you see is black and white.
Yeah.
You see white and black.
So, but there is more to it.
There is so
from the diagram, the nerves.
Yes, there's so much you see in the. We can look at someone's eye. That person go and do HIV test, and he does, and the person never knew. But from the eye, you've seen something. Say, no, this thing is. Can I say, go and check your sugar? And the person checks, go and check your kidney. If this can be in the eye, kidney is having challenge at this time. If this can be in the eye, this organ is having challenge at this time. So that is the good thing about meeting a consultant. Yes, that's the good thing there. But people, I don't know why people are afraid. Financial implication of that. But I want to encourage us, if you notice, since I've been talking, I have not talked about seeing a consultant in a private hospital. Yes, I can be seen privately, but how many will afford it? Now, since many cannot afford it, graciously, there's the place I can be seen by all in the government hospital. Yes. So, and government hospital pay is subsidized. So that's why I'm encouraging people, try and come to where you see an expert and you get the best of care. Okay,
so since we're talking about myth, sorry Eddie, since we're talking about myth, what is the connection with carrots and the eye? We talked about that.
Yes.
But there's this myth that carrots, cures everything about the eye. Go and eat carrots, carrot juice, carrot this, carrot this.
The one thing about carrot is very rich in vitamin A. And that RS study I mentioned, age-related eye disease study, one of the vitamins that's recommended for eye is vitamin A. Yes, so and carrot is rich in vitamin A, not just carrots, even cucumber and the rest of them. Yes, why cucumber is fantastic is that it can be easily taken by those that are diabetic and not have any fear of sugar. Yeah.
Okay, so another thing is how to take these things, because some could say, yeah, they can tell you take carrot, but there might be a specification, either when to take it, when not to take it. You take it on an empty stomach, Do you take it late at night? Do you take it all, you know? So you answer that, doctor. Then there again, I think you should just, having said all of this, I think you should also let us in on the do's and don'ts about the eye. That's eye care, how to take care of the eye. So let's start from, are there certain timings?
What I would say is, one, you know, a lot of people now are advocating blending. But the rophages has a very important role in the body because it enhances digestion and you know, the movements of the fecal material. You know, one of the reasons why the people in the West tend to have high tendency of stomach cancer is that their food have less rophages. They don't have vegetable in their food. So the food, when it's passing through the intestine, it takes time. So the food makes long contacts with the walls of the intestine and can release toxins that can cause problem in future. However, for us blacks, we must maximize the advantage of our rophages. Yes, our vegetable, our fruits. When you mix it with your food or eat prefer your food, it reduces the transit time of the food. So that contact with the intestinal wall is not there. And the risk of cancer and other diseases is reduced. So what I would say, first of all, we should not throw away the idea of eating the food the way they are. Blending is good. It helps you to take larger quantity within a short time. But the rophages still have a place because it enhances digestion, reduces transit time, and prevents intestinal problems. That's it. For the time of the day, it can be taken. I don't know much of specification about timing, but what I can say is it can be taken on empty stomach because it enhances digestion of other food you will take later.
True. All right. There was a second question.
Yeah, eye care generally.
Yeah. Okay. Before we talk about the eye care, doctor, for children, because it's quite worrisome now that even in the crèche, the nursery level of schooling, you know, we have children using tablets and all that educationally, not just for pleasure. And so, when should we get worried about digital training for eyes? At what age exactly should we begin to worry about that?
Actually, from 3 years and above, we should be. In fact, I just want to believe that educational is part of these programs that we are doing, because like most medical students that come to me with eye problem, when I want to talk about digital eye strain, they tell me, sir, but I have to write my professional exam. I'm reading with my phone. And I say, so what I tell them, I go back to what I said earlier. Okay, if you have to read for a period of 8 hours, break it into 2 hours interval. Then for those educators, what I would advise them is, based on the age of the child, please, if the child comes to school by 8, 9 and closes by 12, you can give them 30 minutes break, interval of break. And also you must incorporate in their curriculum interaction with the outdoor activities, because the brain develops further better when the child interacts with nature than when the child is interacting with device.
All right. Eddie, we're talking about general care for the eye. Okay. We just have 1 minute.
Okay, so well, what I would say within this period is we should just have a good health-seeking behavior. My experience in Nigeria is people don't come to hospital until the situation is bad. Don't wait to be sick to call. You can come as a routine, have an intensive eye check once every year. But if there's somebody in the family who has gone blind from an unknown cause, it may be that thing runs in the family. Every member of that family should present themselves for eye evaluation. If you are up to 40 years and above, age is a risk factor for most eye diseases. So I encourage you to come and be evaluated. Thirdly, vitamin A, we can get it from our gardens. We should go back to eating natural food. It is not a status definition that you are eating burger all the time. You should go back to your vegetable, go back to your fruits. Those things are rich in vitamins, rich in lutein, zeaxanthin, that is healthy for the eye. Then if you are confined to use computer, take intermittent breaks in between the computer. If possible, like somebody's made a contribution, don't face the fan, don't face the AC, back the fan, or keep it adjacent to you. You can also get your blue cut glasses to shield the eye. If you cannot afford any of these, when you go out there, you can wear your sunshade. Sunshade protects from UV lights that can affect the retina, affect the lens. By all means, stay healthy.
Thank you so much, Dr. Ndubisi. Thank you so much. And I'm glad you made mention that the blue cut is not just for fashion.
Yes.
It actually helps. All right, so big thanks to our doctor for joining us today and breaking it all down for us. All right, from us here in the house is bye-bye and thanks for watching.
Yeah, thank you.